eating disorders are extremely complex because it's kind of the crossing of, like I said, like family systems, or certainly family systems. And people often want to know like what causes an eating disorder. And it's so multifaceted. So there's, there can be trauma, there can be family systems or things going on, but there is certainly a neurobiological component to eating disorders, and especially severe eating disorders, that we like has to be part of the conversation. So there are actual differences, measurable differences in kind of the brain wiring of people that end up with really severe eating disorders. The types of eating disorders that I see in the hospital when people are actually hospitalized for an eating disorder for medical stabilization are almost always either anorexia, so restrictive eating disorder, or another disorder that's most people haven't heard of called ARFID. So that's avoidant restrictive food intake disorder. I'll say it again, avoidant restrictive food intake disorder. So both of those are restrictive disorders. And the reason that we actually see people in the hospital is due to the medical complications of food restriction. So we see like physiological compromises, and people would often meet criteria to be hospitalized because their heart is starting to slow down. To conserve energy, the heart is actually slowing down. So we admit people for bradycardia, electrolyte abnormalities. Those are the main reasons that people would be admitted. So we don't see as much bulimia or purging because typically those can be fixed like in the emergency room with a bolus IV, like just rebalancing electrolytes. So usually people are in the hospital because they have the medical complications, the medical cost of not eating enough and the impact on their heart specifically.
Wow. And then is there any other kind of organ issues that kind of come alongside of that?
Yes, so many. So
Can you kind of paint the picture of like how bad is it really? Like, I know your focus is more on maybe the psychoanalysis and like the mental side of things, but I always think like, it's all intertwined, but like I know you know a bit about nutrition too.
Yeah,
So I was just like
yeah.
my nerdy health side goes into like, well, what else is going on in the body and how destructive is it?
Every system is impacted by malnutrition and restriction. So we really focus on the impact to the heart and to the brain. So I wish I could show you my screen. There we have some very impactful MRI studies where we've taken photos of people's brains when they're restricting and then people who haven't restricted. So one that I often reference is an 11-year-old boy with anorexia, and then an 11-year-old boy with no eating disorder. And you can see actual brain matter loss. So white matter and brain matter with brain starvation. And the body doesn't like empty space. So the body fills those pockets of the brain with cerebral spinal fluid. And having that extra pressure and having those brain changes, having the loss of brain matter actually impacts one's ability to think and process, and then impacts every single organ and every single system in the body. So we see compromises to cardiac function. We see the slower heart rate due to conserving energy and actually loss of cardiac muscle. We see changes to the digestive system. People forget that with dramatic weight loss, you don't get to pick and choose where you lose weight, right? So you lose muscle mass everywhere, including your GI system, which is smooth muscle.
Oh,
So
interesting.
you lose motility, and you lose like efficiency in your GI system. So often when people have been restricting and try to eat again, it's extremely uncomfortable. That is the number one complaint we get in the hospital because they have really slow motility. We see changes in the like hormonal system. So looks like a loss of a period for a young woman.
Right.
The really scary thing with that is in order to stop one's menstrual cycle, the body stops producing estrogen, and estrogen is the key component for for women to lay down new dense bone. So we actually see bone density loss. So we've had patients in their late teens and 20s who have been struggling with an eating disorder for a number of years, and we'll do scans of their bones, and they'll have the bones of like an 80 or 90-year-old and be at high risk for fracture, actually have osteoporosis as a teen or young adult. kidney function, the whole metabolic system gets out of whack. I mean, it is through and through wreaks havoc on the body.